Hi, I'm Duane Carey, and welcome to The Point, where we feature one interesting guest for 10 minutes or less. Today, we're really happy to have Dr. Pascal Crosley, a board-certified emergency physician who was most recently the chairman of emergency medicine at St. Agnes Hospital and operates 2 urgent care facilities in Montgomery and Howard County in Maryland and 4 testing facilities. Pascal, welcome. Thanks for being here.
Thanks for having me, Duane. Excited to be on with you on The Point.
It's great to see you. I know you've been a very, very busy guy these days.
I have. I've been very entrenched in fighting the pandemic, sort of serendipitously. I opened my first urgent care in 2019 in December, and by February, the pandemic hit, and I was all in on trying to figure things out to keep the public safe and testing strategies and ways to get us sort of back to where we need to be.
Yeah, let's talk about that more. I remember when it was just starting, I want to say the positivity rate of the testing you were doing was up around like 50% because you had so many acute cases. Nobody else was doing any testing, but you were.
Yeah, that's correct. So a lot of frontline workers were coming in, guys that did not have the either means or ability to work from home, as some of us as fortunate as others to be able to work from home. These are guys that had to go to work, and the pandemic was rapidly spreading in the community, and those guys were coming in pretty sick with fevers, typical stigmata of COVID disease. Pretty sad, actually. In the beginning. But yeah, we with my experience as an emergency doctor and the sort of the courage of my staff, really, we remained open and developed a testing strategy that proved to be very beneficial for patients and the ensuing community.
Yeah. Okay. So why don't we talk about that? Let's start with your main point. What's your main point, and then let's expand upon it.
Sure. My main point is that we've spent a lot of time understanding this disease process from other countries and internally. There's been a lot of scientific look back and look forward to what we can do to try to mitigate transmission of disease. And I think that at this time, with rates coming down nicely, social distancing being more prevalent in the community, I think that, and there's a lot of evidence to support that we can start to open up a little bit further here and get back to school and work safely. Now that, the transmission rate will not be dropped to 0, but we can mitigate it at safe rates, understanding that that's going to take work and preparation. And so that's really the main point, is that, you should not return to work or school sort of willy-nilly. That, school systems, aggregate settings of work should take significant precautions to get back to work. And the CDC has sort of put forward some guidelines, restart readiness checklists and things that can assist businesses to get back to where we need to be to bring folks back to work and to bring children, et cetera, back to school. And that's what I mean.
Great. So we can get back to work and school safely. It's just a matter of how. So, right. Before we get too much into the details of that, I thought it was really interesting to see that I think you are the #1 COVID tester in the whole state, over 200,000 tests that your facility has done.
Yeah, we started from the beginning, and because of that, we've had a really tremendous amount of process improvement, that we've been able to process patients quickly and accurately, and provide the results quickly and timely. And because of that, that sort of snowballed. And we have with a partnership of Howard County and the Howard County Department of Health, we've opened 2 testing centers at 2 fire stations, and then an urgent care in Montgomery County, and as you mentioned, our 4th one here in Clarksville. So it's been a tremendous amount of volume. It was painful at times. We were happy to be there for the community to get what they needed, especially around the surge, Thanksgiving and Christmas. It was unbelievable. Hundreds of cars. We have drive-throughs as well as walk-ups. So it was a crush of patients, stressing on the staff, but we really worked hard to deliver the service.
It was amazing. I remember watching it and seeing some of the photos of the the line of cars. So we've got about 5 minutes to get into the meat of this. So tell us, Dr. Crosley, what has to be done to open up the schools safely and open up the workplaces safely? What steps can people take to do it right?
Yep. So I think the infrastructure of folks that are accepting people back in, whether that be the school system or businesses, need to, adhere to the guidelines. And again, the CDC has put out some significant guidelines to bring people back. And just to go over a few, you can implement health checks, right? So there should be some sort of decision rule where folks, if you don't have a fever, you haven't been exposed, you don't have symptoms, you're okay to go back to work. Certainly that, yourself and your child or yourself going to work should surely be screened for medical wellness, right? And then, there's a lot of other things that can happen inside of the school systems. For example, you sort of cohort, and this is happening already at some of the private schools that are already open in places in the other part of the country. For children, you can cohort them, right? You can bring them in a hybrid setting, and you keep them separate. So maybe Mondays and Thursdays, a certain set of kids are on one side, and then Mondays and Wednesdays on another side, and you keep them pretty segregated so they don't have a lot of intermixing and keeping this students sort of separate. Same thing for work, right? You can bring them in different days, different times, and to try to keep them cohorted. Obviously, the disinfectant techniques, ventilations, as well as strategies for if there is an outbreak, right? We recommend getting involved with some sort of medical professional, and then of course testing, right? We think that an integral part of this can be surveillance and testing. That'll keep the transmission rates low. You'll pick up some folks that may have some asymptomatic, might be an asymptomatic carrier. And so we think in conjunction with the CDC's guidelines, as well as effective surveillance testing, that again, we can bring folks back with a low transmission rate at work or at school.
So you mentioned medical surveillance, and obviously a big part of that is testing. But are you guys at Quality First available for larger employers or school systems for consultation, so that actual medical doctors are being involved in this?
Yep, and that's the strategy of our particular facility, is to provide medical leadership, whether that be in consultative services, telemedicine with your patients that may come back positive, return to work if they have an outbreak again, return to work notes and quarantine recommendations. So we give those we offer ourselves as sort of medical leadership and experts in this, right? From a medical physician and our medical providers, giving some support to the businesses and schools if they need it, right? Surely as the setup, and if there's any sort of types of outbreaks, and then of course our testing. We have an in-house testing facility with the best test there is, reverse transcriptive PCR. We do that in-house. We can return those results generally within 12 hours. Because you really want to, if there is an outbreak, you want to focus, test quickly, and quarantine quickly, right? And waiting too many days is too effective. So having the lab inside of the house, inside of our urgent care, is beneficial to us. And yes, we are available for large-scale testing of school settings as well as large aggregate work settings.
Okay, well that's great. We'll provide your contact information on our website and the URL for Quality First, so people can reach out to you if they need to. So that's wonderful.
Absolutely.
Yeah. You have well, I would love to make a shout out to you first of all, because I've been kind of with you throughout this whole thing, and I've been amazed at how much you guys are working and how hard you're working, and you guys were taking risks at the beginning when everybody else was shut down and wasn't seeing patients. So props to you for seeing those really sick people who, we didn't know what the heck was going on with this virus at that time. So, but a shout out from you.
Thank you, and that's a dovetail to my team. I have two shout outs actually. Number one is the courage and the real heroes on my frontline team, Quality First Urgent Care, right? The people that hung in there with us, took some chances to try to service the community when we didn't know a lot. That's my first shout out to my entire team and all the people that have done the swabs, and my PAs and my MAs and everybody at my place. And my second shout out, of course, to the family. As you know, being in the environment that I was in, was a lot of stress on my wife and my 3 kids. And so I have a big, large shout out to them for the support and the love that they've given me through this last year.
That's awesome. We're, we're proud that you're a hometown Howard County guy. Went to Towson for undergrad, and then of course all your medical degree and postdoc and everything. But we're glad you're back here in Maryland and doing all this testing. It's fantastic.
I'm happy
Dr.
to be back.
Pascal Crosley, thank you very much. Quality First Urgent Care, and like I said, we'll put your contact info on the site. Thank you, sir.
Thanks, Duane. Good work. Thanks very much.
Bye-bye.
Bye-bye.